thank you so much for staying with the Monday Report. The town hall session begins right now. We are talking about the plight of persons living with disability. Have they been treated fairly? Did you know that the National Disability Policy is still on draft stage since 2006? That is a record 17 years. And there are people living with different disabilities. I'll start from my left. In the audience, I have caregivers there, I have special needs occupational therapists, I have parents of children living with disabilities and also persons living with disabilities. They'll tell us what the challenges are, plus what they deem the solutions would be. We'd also like to hear from you at Trevor Mbija at Citizen TV Kenya. Use the hashtag Monday Report as we have this conversation. And then on my right, I'll start from the farthest right, we have Isaac Wanyonge, who's a Senior Disability Services Officer, National Council for Persons Living with Disability. Thank you so much for making time. Also followed by Father Gideon Ombori, Catholic priest and director of Don Orione Centre at Kaburugi. Thank you very much for making time. Honorable Wanjiku Muya is there here. She's a member of Parliament for Kipipiri, also a disability advocate in Parliament. Asante sana for making time. And last but not least, Mr. David Omusi, National Coordinator, Lay Associates, Don Orione Mission in Kenya. Thank you all for making time. And I'll start with you, David. Do you feel the government has done enough to raise awareness on disability safeguards to date?
Enough is really relative. Why do I say enough is relative? We compare the tremendous job that the government has done so far. We applaud it in terms of setting up the infrastructure. But having said that, there's still a lot to be done. A lot needs to be done, and that is why we are here today, so that we can establish what is this a lot.
Yeah.
So that from this debate, the government representatives are here.
Yes.
The legislatures are here. Honorable member is here, very passionate about matters disability. So I think from here we have a national discourse.
Yeah.
And with this national discourse, we will establish the way forward.
We can actually just get into it right now. What is enough? What more needs to be done so that they respond to your question as we start?
In terms of executive, of course, we have the national disability policy that is lagging, as you put it very well. It is one matter that if addressed properly, or if it is handled by the government, because it is in their domain, we will have a clear framework of operation. That is modus operandi. Yeah.
You feel that is the silver bullet?
That is closer to a silver bullet.
Okay. Closer
to a silver bullet. India, a nation of approximately 1.4 billion, has a national policy adopted, effected, 20 pages. Yeah. What is so difficult? We know the government is working in terms of, laying the groundworks, but we are saying, please, let's have this issue out of the table. Okay. So that we can have these things running. Yeah. It is too long to wait for 17 years, surely.
Honorable Muya, would you say that the legislative arm has failed persons living with disability in this country? And what have they done to safeguard the rights of PWDs?
Thank you very much for having me here. I really advocate for persons with disability in Parliament and outside. I am actually a champion, because you may call me an advocate and someone may think tomorrow I can represent in the court. Is that I advocate. But having said that, I say yes, it has taken rather long, because 17 years or even 5 years is too long. But I would say Parliament as an institution has done a lot. First, there have been several small pieces of legislation trying to align to the UN Convention or to the Human Rights and our Constitution, Person with Disability Act. But in the previous government, there was a cabinet directive that we need to repeal the whole 2003 Act. And as such, the government did put on the table the whole bill. Yeah. But in my view, from where I sit, I feel persons with disability matters should not necessarily be a government agenda. It should be holistically handled by everyone, because we have a number of community, civil society, person with the deaf community, visual, physical, learning disability, and I think these are people with the capacity even to handle this bill. But either way, the government has done its bit. But in the previous parliament, the parliament was dissolved at the first stage of reading this bill. And the National Assembly works in tandem with the Senate on some matters, particularly person with disability bills. Yeah. And we found that there was a similar bill at Senate, spearheaded by Honorable Kamal and Senator Asige. And this bill had gone to quite some steps to the third reading. Currently is at the third reading. So there was an informal arrangement that instead of National Assembly doing this government bill, and then it shall still go to Senate and even take longer. It's better this one at Senate come to National Assembly, and whatever is lacking, we fill it with this government bill. Okay. So we are there. But in terms of time, I think it has taken long. But if you look at the small pieces like the improvement of age limit in terms of retirement from 60 to 65, that is, I think, a piece of legislative which is just one of aligning to the statute. Okay. If you look at what I amended personally, the amendment of 2003, which I pushed this sign language interpreters to all your TVs, that was my bill. That is still another legislative which is trying to align with the UN Convention. Okay. We have quite a number of pieces which are still coming, because, you know, a law cannot just wait forever. And as it is the case, I think it's taking long. Okay. But I feel the Parliament has continued to improve, and I think we are almost there. Okay, let me bring in Father Gideon on this. And Father Gideon, Mheshimiwa is raising an interesting perspective of a multi-sectoral approach. So what role then does the church and institutions play in safeguarding the rights of persons living with disabilities? And have you done enough?
Well, thank you so much, Trevor, for having me here today. And I think as a nation, we need to come together. This is not a one person or one institution is the work. And that's why the Catholic Church, in particular, because I speak of the Catholic Church, I am quite familiar with what it has done. It has contributed and continue to partner to contribute to to support what the national government is doing. And in particular, the Catholic Diocese of Muranga, for instance, has advocated so much for the child protection policies. We have put up institutions that are serving children with the intellectual disability. For example, the Orione Centre in Kandara. We offer in that institution therapy, physical, occupational. We offer also individualized education. We provide them with food and some other even assistive devices. And that's why I believe that we need more institutions to come on board. Donorione is also present in Kajiado, so also in the Catholic Diocese of Bungong. So the Catholic Church, I believe all over the country, has something to do with children with disability or youths. And we call upon other stakeholders to come on board, that we need to work together to realize the dream of, All
right, let me bring Mr. Isaac here. Mr. Isaac, what is the status of this national policy of persons with disability that has been in draft since 2006?
I think we need to understand that the Act was enacted in the year 2003. The Convention was ratified in 2008. Then the Constitution came in 2010. Now, these changes and the shift in terms of legal has affected that anytime the policy needs to move to another level, then another major milestone is done. so that if from 2006, 2003, by 2008, Kenya ratified the convention. Then it meant that the act is supposed to align itself to the convention. Then in 2010, we promulgated a new constitution. Then the act still needs to align itself to the constitution. Then this delay, it is both good and bad, because disability is evolving. It's very dynamic. Even as in the city, I talk about the neurodiverse.
Yeah.
If the policy could have gone through by 2006,
yeah,
the types of disabilities that were known were only physical, visual, and deaf. Nobody was, I think, about the neurodiverse.
Yeah.
So
it's already obsolete as it is.
Yes, it is obsolete as it is, because so many things have come in, and we need to align ourselves.
Yeah.
And one thing I know is policy making is a function of our ministry. And the Ministry of Labor and Social Protection is working on it now, and bringing now all these ideas together, and see that how does now this policy align itself with the current trends.
Yeah.
So the delay has been there, but from where I see it could have been a blessing in disguise.
Yeah.
That by the time this policy will be through, then it will have covered all the needs and aspirations of persons with disabilities.
Okay. It's interesting that you mentioned the ministry. In fact, in the audience here, I have caregivers, I have special needs occupational therapists, I have parents of children living with disabilities, I have persons living with disabilities. You have the microphone over there, sir. Just start with your name and then mention what are the challenges that you see and what are the possible solutions. What are the challenges you've been facing and what are the possible solutions going forward?
Oh, my name is Benson Isaboke. I'm from Site of Relief Organization. The first things first. As a country, we know data follows resources. That is my first challenge that I'm facing as a person who has disability. As we are discussing here, we don't know the right population of persons with disability in the country. And it's now going to take us another 10 years for us being limited to have the rightful services for persons with disability. So as a recommendation from me as a person with disability, is the president need to take an action, put in place an agency, be it a research, to have the right population of people with disability, so that the National Council, which is our main body, can be able to have the right budget to give us the services. Like now, we are understaffed. We don't have assistive devices. If you go to the systems, there's a lot of queue people wanting the assistive devices in this country because of under-budgeting. So that is the main key that I will be able to address, so that it can be able to be addressed with the most urgency.
Okay.
So that we can be able to have the right to services as people with disability.
All right. Thank you, Benson. You can pass the microphone to the next person, but there's a microphone up there. Yes, go ahead. Start with your name and mention what you see as the challenges going forward and what are the possible solutions.
Okay, I'm James Njoroge, an occupational therapist. On the side of therapeutic interventions, the main challenge is late intervention. You see that the parents are bringing their kids to be intervened, let me say therapeutic services, when they are too late. You find that a kid is brought to you when he or she is 10 years or 12 years. That means the disability has progressed so much to a point that this kid, if he or she could have been attended earlier, the result could be positive or fulfilling. Another thing is stigma from the society, the societal stigma. You find that a parent opts to hide his or her kid because of the way society is taking that kid. So instead of bringing him or her to the service, he hides the kid into his or her house. Now that paralyzes the service delivery to this kid.
Mm.
Yes.
Okay. Thank you for that. Yes, ma'am.
Okay, my
You can pass the microphone back there, it's okay. Yes, go ahead.
My name is Beatrice Nyambura. I'm a special needs education practitioner working with children with intellectual disabilities, mental conditions and syndromes. So one of the challenges that we face is ignorance, whereby there is a lot of discrimination on children and youth with intellectual disability. And what I can advise is on campaigning, sensitizing, and advocating for these people.
Okay. Yes, go ahead.
My name's Gislin Kinywa from Different Talent and Society of Kenya. So from the caregiver aspect, because I'm a mother of an autistic child, there's the lack for mental health support. And like if you look at me here, I'm different, and my colleagues here, we are different from the person that you can see. So indirectly, we are disabled. We are in a situation where we are not able, but we have to keep expressing this to every door we knock with our children, because normally I have to speak for the child. And our children are teenagers now. You easily cannot identify them because they are left behind. So the mental health aspect for caregivers is still an opaque area. And if you come to our platforms, we've had parents that really we have to refer them to other places for care because they've reached the end of the road. They are not able to support, especially when our children are a bit small, it's manageable. We are happy to move around with them. When our children grow to teenage level, it becomes a bit difficult, and we still have to be able to take care of them. For example, I'm a mother of a baby boy. A big boy now is 19 this month. It reaches to a point where now most of our caregivers are ladies, because somehow it happens that we end up being ladies taking care of these people. I'm not able to carry my boy now with me. If I go to the hospital, I have to use the gents with him. So if I have to go with him somewhere, there are things I can't do with a 19-year-old. So there's the aspect of all that as a challenge, because eventually sometimes you go back and you meet a person who is dragging the big boy with him. When you go to their car, if they were driving, they break down at the end of whatever activity they were doing before you go back home, because the experience you're through puts you down for long. So mental health aspect for the caregiver is really an opaque area. And I'm hoping that this policy that come around does not only address the issue with disability alone, leaving the caregivers behind. When they are 40-year-old, we have parents who are asking, where do I give up this boy? He's so strong for me now. I'm aged, I'm not able to move. So the government needs to really look at all this, even as we know that the institutions are being brought down. How do we have these children now taken in? Our families, some of them are good and supportive. Others do not want the burden. 40-year-old, no, they don't want. So mental health and caregiver aspect, including even the person that is in that situation. Okay.
You have the microphone there. Yes, go ahead, and you can pass the microphone as well down here. We'll have to talk about that. Yes.
I'm Ruth Mudhoni. I am a parent who is taking care of a special needs child. My daughter has cerebral palsy, and I would say that we face a lot of challenges because each and every day you have to use diapers. For example, my daughter uses around 4 diapers in a day. So in a month, I'm going to spend around 4,000 shillings on diapers. So I also happen to be a registered nurse. So I'm able to know that, for example, in the sub-county hospitals, we might be having only one therapist attending to all the children in that area, in that sub-county, who are depending on them for therapy sessions. So you find out that even when you go for therapy sessions, you'll have one session today and then you're going to have another one next month because you don't have the staff. And just like my brother said, that the government needs to know the number of the people who are in a certain ward or a sub-county so that they can be able to account for the staff members that they need to take care of these children. So we go through a lot of challenges, and also when the government is making the policy. When they say that they are having the tax exemption for people living with disabilities, where do they put the parents of that child who is taking care of a child who is having disability? Do they take them into account, or they just decide that the only person who is supposed to be exempted is the only one who is disabled? But that parent, this child cannot speak for themselves. For example, my daughter, I don't expect her, like, in few years to come that they are going to get employed, or maybe they are going to buy a car, or maybe they are going to do things for themselves. So I am the caregiver, and maybe my husband. So we are the people who are accounting for each and every coin that is in that house. So it is important for the government to put into the policy and to take care of also the caregivers who are taking care of these people and these children.
Okay.
Thank you.
I'll come back in just a bit as you pass the microphone. These are very heavy issues being raised, and Isaac, I'd like to hear your reaction on most of them. Benson started by saying data follows resources.
Yes.
Do you know the number of people living with various disabilities in the country? Do you know where they are and what needs they have?
I think from last year, January, we began a very robust registration and migration of persons with disabilities to our new registration data system. Now, the new system is has three major components. Number one, it's about digitalization. We are digitizing because the cards that we were having before were not verifiable. You could not know which card belongs to who. That's one thing we are correcting. Number two, in the new system, you are able to map a person with a disability up to the village level. Up to the village. You know which village, which ward, which sub-county this child is coming from. And then three, in terms of categorization, the Ministry of Health launched the guidelines on assessment and categorization. The way we are doing the categorization now is that you are able to identify the type of disability. Before, a child with cerebral palsy was classified under physical disability. So you could have a card physical, but you cannot know which type of physical disability is this one. This new system is able now to pull out a child. Like a child, if the card reads mental, what does that mean? Is it autism? Is it bipolar? Is it schizophrenia? So the current system is able to align that. About the digitization, the president has given a directive that all government services must be done online. And the council is following suit that going forward, registration is going to be online. Immediately after the assessment, you log in, you register, ours will be only to approve. And about the card, you will have realized that since March, we have not printed any card. Because what the government has done, it has developed what we call a central data. That if you are registered in the new registration system, we are going paperless. You will not be able to get a card. But when the new Maisha card will be issued, that is an identification card. Yeah. There is no need, I have a national ID, then I'm supposed to have another disability ID. So what the council has done, it has infused that we are going to get one card. Yeah. We are going paperless. Okay. Even for the few of us who already have the new cards, okay, it has a QR code. But
what about the caregivers? There's an issue that was raised by Ruth here, saying the caregivers are the ones who should be tax exempt because they're the parents and they're taking care of the children. There was also an issue of the mental health that was raised, that sometimes they literally break down from the pressure of taking care of someone. And she mentioned a 19-year-old son. Is there something you're working for the caregivers?
I agree with her that they need to be exempted from tax. But the question from where we sit is, under which law?
So that is where the we and the others come in.
Because tax exemption for persons with disabilities is anchored in the Disability Act. So it is the Act and the exemption which has been operationalized is for persons with disabilities.
Not
so under which law?
Okay. But that is where now we bring in Wanjiku Muia as the legislative arm of this. Is this time now to bring an amendment in Parliament?
I think, thank you very much. First, we need a comprehensive survey. I agree with him because the 2019 census indicated we have 1 million persons with disability. That number is just too low. It is not realistic because even World Health Organization survey says every population has 10 to 15% of person with disability. So by that we can see clearly we do not have data. And as he rightfully put it, numbers are followed by resources. In that case, then we are not able to budget accurately. Even if we want to strengthen the National Council, we don't strengthen them as it should be because we do not know how many devices they need and all that. So data is clearly very important. And I think this Act of 2023 now, hopefully, it must really adopt the issue of caregivers because she rightfully put it that her daughter or son will never need a car. So she's the one who needs this tax exemption. So I take that and I think it is worth having a discussion. But I think as a country, we need to have a candid discussion and we need to be real. A month ago, we have gone around the country registering the Inua Jamii people. I was shocked in my constituency. I went in one location and 91 children were brought to be registered. So this issue even of online, and I don't oppose his idea because it is government idea which I'm serving. I think even as government we need to relook. Look at this mother who is at Marsabit or another corner somewhere, who is living in poverty. So the issue even of online does not even occur in his mind. That time when we were registering, I was asking them, do you know you should be registered by who? Do you know you should have assessment by who? They do not even know there should be assessment or such. So I think as a government, we need a candid conversation. It is good that National Council have been devolved at county level. Maybe we need to re-devolve them again at constituency level and possibly have mobile clinics which can be moving from now constituency to local and to more mashinani because those are where those children and even adults are. Who will never realize the benefit of any tax that we give in this country by any device, any diaper, any support from anything. And I think this is where now the government, through the Ministry of Labour, particularly, because even this parliament has established a committee of social protection. Before, this committee was together with the committee of sports, and matters of disability were getting lost. Now we have a committee which can follow that avenue to the latter. So I think we need to face it as it is. See, we are not doing well. A country is always respected by how far we raise and embrace and support the less fortunate in our society, and this is the community of persons with disability.
As a champion of PWDs, can we count on you to bring amendments that will cover caregivers, their mental health, and of course have some tax exemption for certain caregivers instead of
and on that point, allow me to inform our citizens or our viewers that this parliament established a caucus called KEDIPA. KEDIPA is Kenya Disability Parliamentarian Association. We established this in 11th Parliament, myself, Honorable Maura Timwanyonyi, and few others. This is the caucus where you can bring any idea. So I welcome them. We have secretariat at Protection House or within Bunge, and any idea, do not keep it for yourself. Count on us. We shall move with it and put it to the right perspective to serve this community.
Definitely. I hope you're taking the ideas from them because this right here is a free public participation for every intervention that you want to bring in. And David, let me bring in on this. There was an issue that was raised by Beatrice in terms of ignorance and discrimination. How can this communication be put in such a way that then we take out the stigma and the ignorance from the people themselves, including the public?
Indeed, thank you very much, Trevor. The reason why we are proponents of awareness and advocacy is to accelerate so much that this can reach far and wide. And I thank you very much for also joining the campaign, because indeed, as we were having our conversation, I told you, as a media stakeholder, you are a non-state actor, you have a role to play. Each and every individual in this society has a particular role to play to make this, to improve the lives of PWDs in Kenya. So how do we effect that? It is a responsibility of each and every individual, the state actors, non-state actors, and we go for low-lying fruits. It is possible, as we wait for the big movements, the big policy framework, the big legislations, it is possible to work within a framework of bottom-up. Because bottom-up, for me, is you deal with the easy thing, you know? Yeah. Easy thing, the things you can actually just reach and pluck. Yeah. And they are there, we can notice them. We thank the president for initiating the factory agenda. That is a public policy, which is going to come up in the very near future. He will tell us when. But we are saying, as we wait for the big plan of setting up a factory, that is a 10-year, probably 15 years plan. Very, very good, fantastic plan. But I know with him here and Mheshimiwa here, we can really go for the low-lying fruit. We can do something so people can access the devices. We can accelerate advocacy together with these beautiful groups of people. Yeah. The DPOs. Okay. Yeah. So for me, is each and every person's responsibility. Okay. State actors, non-state actors.
All right. Yeah. And Father David is raising an interesting thing, the low-lying fruits, and Benson also talked about it, assistive devices. We know the Catholic Church is a very rich church. Why don't you just take on some of this, like you mentioned that they are already supporting? Why don't you extend that support to even assistive devices like what Benson
I think, Trevor, one of the things that we are trying to change is the narrative that support must be from one sector. You know, the government is the elephant in the room, and we know how much it has struggled with keeping up with the needs of people with disabilities. Now, the Catholic Church is not the government, but it is doing amazing, I would say, within its powers, you know, in terms of complementing what the government has done. And if there is one institution that I will confidently say that has done quite a lot and well, it's the Catholic Church. Because from the institutions that are there, that each and every one of us can testify they are there. I just mentioned we have the Orione Community Training Centre, Kandara, Kafurugi, that is in Kandara. We have another Orione Community Training Centre at Kajiado in Rongai. We have another Orione in Gaturi. We have quite a number of institutions that they are under the Catholic Church. So the Catholic Church has done a lot. The only thing that we need is that we need to have proper facilities, proper support, so that we can be able to do more. Because there is a lot of struggle, because the Catholic Church is not the government that has a lot of money. It's doing it because of the goodwill of people, Christians, you know. So I will say, Trevor, that the Catholic Church continues and will continue to do. Like now at Orione Centre, we have a program for the whole day program for therapy, funded by the Catholic Diocese of Murang'a. I would really want to thank the Bishop of the Catholic Diocese of Murang'a, Right Reverend James Maria Wainaina. So this is something that I think should be copied and implemented all over the country. What happens to children when they close schools? Yeah. For 2 months, that's quite a lot for someone who is undergoing therapy, rehabilitation. So if you have an injury, let's say you underwent an operation, and then you do therapy for 1 week, stop for 2 months, what will happen? You have to begin at zero. So that's why we have, as we speak, we have a program where, as Orione Community Training Centre, Kafurugi, with the support of the Catholic Diocese of Murang'a, we offer therapy to children as they are back home for their holidays.
Okay.
Trevor, if you may allow me to come in on that point, I appreciate, and I know every other Kenyan appreciate that the church really compliment the government, but I think we have come of age. Every government has to take care of its citizens. And I think the person with the disability are not second citizens. They are also primary like any other person like me and you. So of importance is to have the right data. No, we have 50 million Kenyans, and out of 55 million persons have disability and they need support A, B, C, D, because I think it's a bit shameful that persons with disability have to remain on help, community help. So it's like this is not their country. It's like they are not part of the community. I think we should really just accept and appreciate the church. It's a compliment. Yeah. But as government, I think we can do more. Yeah. And I think with this administration, I think we can do more.
And most of that will come from you as the legislature. Do you have support from your team in government, in parliament? Because we know some bills have been lying there for years.
I think anytime we have raised any issue on matters of persons with disability, Parliament have acted very swiftly. Okay. In fact, you have seen even on media, a team like Deaf Olympia denied visa to go to Denmark, and we quickly mobilized members and we condemn that. We have always kept very vigilant on any denial of any rights of person with a disability. Okay. And just to let you know that the month of October is normally a month of dyslexia awareness. Yeah. And this I say every person should be making awareness of any kind of disability. And the Parliament of Kenya has been in forefront for the last 2-3 years. Every October we paint red in Parliament. Maybe you have seen me also in red ribbon. At least I'm happy David was able to join us. And he can confirm that several members of Parliament, Senate and National Assembly were there trying to create awareness. So I think we are up to the task. And we cannot leave it for Parliament or a church. We should all work together as Kenyans, and this is our baby that we should deliver together.
All right. I have to take a quick break here on Monday Report. When you come back, I'll come back to the audience because they're the ones, the first-hand information on this. And of course, this is like a free public participation to the legislatures here so that they hear the issues from the ground and the issues that they want addressed. We'd also like to take some of your feedback when we come back at Trevor Mbija at Citizen TV Kenya. Use the hashtag Monday Report. We're back in just a bit.